Here to start us off tonight is Dr. Doug Pogue, BJC, Medical Director of Accountable Care at BJC, Associate Chief of Medicine at Missouri Baptist. So let's start kind of in that range. I don't know if that was a good analogy or not, but tell us, let's make sure we're on the same page. What is a primary care physician?
Right. Well, it's simply put, a primary care office is where most people get most of their health care. It serves as sort of their medical home, the founding base where all of their other medical decisions can be made. The one thing that's unique about primary care is that it doesn't just offer a medical service that's available when someone happens to need it. It offers a relationship. And so that relationship lasts years and sometimes decades, and takes people through the whole course of their life, all the ups and downs, and it provides this vital context to which you can really speak into their medical problems. One of the things that happens over and over again is I'll walk into an emergency room with one of my patients that happens to be there, and the response is, "Oh, thank God you're here." Now, why would they say that? They would say that because I know them, because they know that here's someone who knows me inside and out, who's been with me through thick and thin, and even if they can't articulate it, they know that if that person is here, then the diagnosis is going to be more accurate and correct for them. The treatments will be in line with many other medicines they're taking or other treatments they're getting. They're not going to get something they're allergic to or some other problem. They're going to be well taken care of because of that relationship.
That's kind of cool. That's how the doctor sees it. Let's talk about how the patient sees it using the pen. And we ask people, why do you go to a primary care physician? Here's what they said. We asked you the main reasons you visit your primary care provider. Here are some of the responses. I go to maintain my health and to treat acute illnesses. When I've put more effort into prevention, the visits that I need to treat acute illness have dramatically dropped. I go to see my primary care doctor as little as possible, essentially only when I am so ill I can hardly pull myself out of bed. I'm over 50 and I need to maintain regular checkups for my continued health concerns. I visit my primary care physician when there is something wrong. I see her less than once a year because of my own difficulties accessing safe, affordable transportation. I refuse screening for cancer because I already struggle just to survive on Social Security and disability. Now, I have to say it's odd that all of those people have a voice that sounds very similar, but we'll get past that. Does any of that ring true to you? I mean, you're talking about a very positive view of what all can come from a primary care physician, but we got folks there saying, I go as little as possible. Well, right. So a couple things need to be true. You need to be comfortable where you are. You need to have a physician that you trust, that you have a good relationship with, that you can speak with openly. When you have that kind of relationship, people tend to go. The other issue is really prevention is everything. You know, nothing is more powerful than decisions you and I and everybody in the audience here make every day that impact our health. Foods that we eat, other choices and decisions we make, that mixed with structured screening in a professional way by somebody who knows what they're doing has a dramatic impact on how healthy and well people will be over time. Waiting until the one typist said, until I can't crawl out of bed and I'll finally go. We can help him, but we couldn't help him nearly as much as we would have been able to had we been able to head that off, so he never was in that position to begin with. Okay, so is that relationship changing then? Is it, I don't know, getting worse, falling apart a little bit? Well, actually, I think some of them are getting closer, but there's a change in nationally how we treat primary care. People are starting to realize and get back to basics that primary care really matters. And there's a mountain of evidence out there that if people have access to good, high-quality primary care, they'll get sick less often. When they get sick, they get better faster. They stay healthier longer. They have fewer safety errors, bad medicines or things that cause problems with them. Their satisfaction with their health care and how well they're being taken care of goes through the roof. And all of that costs less than what we're doing now, with having, as you mentioned, different contractors all trying to treat the same patient in a random kind of way. Give me one more definition before we move forward tonight. Accountable care organization, that's something I know you work with. What does that mean? What is accountable care organization? Right, so an accountable care organization is a group of providers that have gotten together and are dedicated to try to improve the health status of our senior patients, those who are on Medicare and benefit from Medicare. And so we try to do a couple things. We try to give them better and more coordinated health care. We try to make the information about them more transparent and portable. And what I mean by that is, take the example I just put in, where I walk into an emergency room and the patient says, there's the guy who knows me. Well, what if that context, the information about somebody, would travel with them
wherever they went into the health center. So no matter who touched them in different aspects of their health care, that information goes with them. So everybody now kind of knows them, instead of somebody simply being good at their job but having no idea about the individual person. So if we do that, we surround folks with information and knowledge, we provide that to all the people who are touching them, you're going to get more informed and better decisions. That leads to better health care. And interestingly enough, it's cheaper.